Channel 6 News live at 5 continues with today's Family Healthcast.
It's an often painful condition that affects 1 in 10 young women. Right now, there is no cure, but as Serese Cole tells us in today's Health Check, there is treatment for the millions of women who suffer from endometriosis.
It's a condition Dr. Nicole Dix is seeing more often. Endometriosis happens when the lining of the inside of the uterus, called the endometrium, gets outside the uterus.
We think it has to do with backflow of the menstrual period. Instead of the blood all coming out, some of it flows back up through the uterus and spills out the fallopian tubes and then has a chance to stick on to those pelvic organs.
The result for many women is pelvic pain and painful menstrual cycles, urination, bowel movements, or intercourse, even infertility.
The way they usually describe that pain is very sharp, stabbing, like almost as if someone had a knife inside your abdomen and was twisting and turning it.
Endometriosis usually targets women in their reproductive years, their 20s or 30s. What's interesting about this condition is some women experience crippling pain. Others don't even realize they have it.
There is no cure, but there are ways to treat it, beginning with painkillers and birth control pills.
If the time where they're really hurting is during their menstrual cycle, if we can eliminate how many times a year they have to have that, then oftentimes they will feel much better.
Laparoscopic surgery is another option, but after a year or two, the endometriosis often grows back. Unfortunately for some, the problem doesn't go away for good until they reach menopause. With photographer Mike Blues, Serese Cole, Channel 6 News.
There are no specific risk factors for endometriosis. However, if you have a mother or sister who has it, you have a much greater chance of getting the condition too. It's hard to diagnose. The only way for you to know for sure if you have it is surgery. John?